Today, I invite Professor Nathan Dawes to join me to discuss mental health advocacy and policies in Australia and how these strategies can be applied to the context of other countries such as Singapore. Professor Nathan Dawes is an occupational therapist and Associate Dean of Learning and Teaching at the College of Medicine and Dentistry, James Cook University. Nathan is a nationally recognized leader in public health education and higher education governance. He teaches undergraduate, postgraduate subjects across public health, health promotion, and health system. Thanks for sitting down with me today, Nathan, for bringing interdisciplinary learning to our students. Advocacy for strategies that support good mental health and well-being, both for individuals and for broader populations, is important. However, there can be some confusions and different interpretation about what advocacy means in practice. How would you define advocacy in a population sense? And can you provide a few recent examples of mental health advocacy in Australia? And also how these examples can be applied to other countries such as Singapore.
Yeah, thanks, Wendy. And look, lovely to be here. And thanks for the invitation to have a quick chat about advocacy and policy and mental health. Look, three things that are very close to my heart, not only in my days as a clinician, but more recently through public health teaching and some of the advocacy initiatives that I've been involved with as well. I think the first thing to sort of point out here is this definition of advocacy. And it's a really tricky one to put a finger on because I think a lot of people interpret this in different ways. For example, in the field of mental health, I think a lot of individuals, practitioners, for example, working on the ground, sometimes just view advocacy as really, speaking up and raising awareness around certain mental health conditions, for example. But when we look at it in the broader population scope of public health, advocacy it's a really core pillar of this discipline, and it's really I would say a lot more specific. It's a set of deliberate actions, I guess, to really influence higher order systems around us. Yeah, and I'm talking about influencing things like national policies, for example. It might be around influencing funding initiatives, certain health services, for example, or even within our own organisations that we'll go and practice within in a couple of years' time. Advocacies can be set about to try and change some organisational processes for the better, and really so that we're keeping a focus on trying to increase or enhance mental health and well-being for the populations and the communities that we service across our health professions, and not just focusing on the individual. And I guess that's where the difference comes in here for public health in particular. So it is a really tricky one to define, Wendy. I think, and I've dropped a paper in the resource pack here, one that we wrote a couple of years ago around trying to understand advocacy within public health curricula. And it was interesting in this study when we drew out a lot of the subject learning outcomes and course learning outcomes across Australasia, that a lot of courses within health actually weren't teaching advocacy that much at all. When we reached out to ask course coordinators as to why this might be the case, it was really because people didn't feel confident or competent enough to really know what advocacy was and how to relay on that information. So I think it's a critical topic, one that we're getting better clarity around, but different people see it in different ways. And look, I think a simple definition that I'd probably use is it focuses on educating, organising, and really trying to mobilise factors in broader systems around us, these levers that can then go on to try and change population health outcomes. And that's how I'd probably best define public health advocacy. So it's really about what we call moving upstream. Okay, and these upstream factors are all around these population level factors, such as policies and fundings and the environments in which we live. And it's more focused at that level instead of asking how do we support this specific individual at this point in time. We kind of switch that narrative a little bit, Wendy, and we start asking questions like what policies or service models in our profession, for example, might be really creating barriers here. what conditions are potentially increasing? What type of mental health conditions are we seeing increasing around us, and that we might need to focus on as a priority for advocacy, for example, or even, getting a real sense as well, Wendy, about who has authority to make these types of decisions around policy and funding change at that population level. I mean, these all come into us in understanding advocacy and how to do advocacy well. Look, aware that we've got a Singapore and Australian cohort in the subject as well, Wendy. So a few examples, I guess, from the top of my head. In Australia, particularly, we've got a number of national peak bodies that, being in the psychology profession, you probably know more about than I in terms of that specific area. But, these peak bodies are really, really, advocacy focused. They look at trying to work ways to reform population settings, through things like official submissions and also public policy statements. I think a good example of one of these bodies is probably Mental Health Australia. These types of organisations regularly publish policy submissions to the government on reform. They bring light to investment priorities in mental health in particular. And this is a really direct sort of pathway for us to be advocating and trying to change decision making at that federal government level, I think. Some other organisations that you're probably all familiar with, Beyond Blue, it's a very explicit that a key action of that organisation is to advocate priorities, particularly around suicide and reducing stigma and discrimination around types of mental health and mental health conditions as well. And they try to push this through again to that decision-making level so that we can have better services designed to try and support people that are experiencing these types of mental health concerns. And this stretches out into a lot of organisations across Australia. I think Headspace is another good example for youth mental health that do a big host of advocacy work year in, year out for servicing or strengthening service capacity, specifically around youth and child mental health priorities. There are a range of different social media organisations as well that you're probably aware of, a range of different campaigns and initiatives. Are You OK Day, for example, is a national sort of advocacy initiative and activities that carry out across the year as well. So just a few examples to bring you, I guess, into the fold about who's working on advocacy at different levels, trying to influence on policy, influence on service design and development and strengthening that capacity as well, but also activities across the year. A couple of examples that come to mind out of Singapore too, Wendy. Beyond the Label it's a national initiative through the NCSS, specifically designed a few years ago to address stigma and to really promote, I guess, social inclusion for people in Singapore living with mental health needs. So that's one notable organisation, I think, that's heavily involved in advocacy in Singapore. And you've also got Singapore's Tripatriate Advisory Group on mental health as well, which I think is a really cool initiative and something that we haven't seen so much here in Australia. It's really around preventing mental health and well-being in workplaces. Providing practical guidance to organisations across any industries to try and make employees and employers really well aware of mental health and well-being and what sort of initiatives might be integrated into the workplace to try and support them with this. A good example of an organisation coming in and advocating for mental health and well-being through trying to strengthen organisational capacity around how to deal with these sometimes complex issues. So, look, advocacy, it's a tricky one to define. People will see it in different ways. We're looking at it through a public health lens. We're definitely looking at the upstream factors, how we can influence on policy, funding as well. And there are a number of organisations that work at different levels to try and advocate for mental health and wellbeing across both Australia and Singapore. And hopefully that went on a bit of a tangent there, Wendy, but hopefully that gives a couple of examples around advocacy in these two settings anyway.
Thank you so much, Nathan. There is an important point I pick up in your discussion. That is, advocacy is everyone's business, particularly for us as health professionals, such as psychologists. For example, in psychology, we have done a very good job to develop numerous individual psychotherapies. But now we found actually individual psychotherapies uh, psychotherapies are very important and very helpful. But we found maybe we need to walk out of our consultant room, our small consultant room, going to the community to do some advocacy. So I am interested in your point, Nathan. What are some practical ways health professionals, psychologists can advocate for mental health and well-being within their day-to-day professional lives and roles?
Yeah, it's a big one, isn't it, Wendy? I mean, particularly I think sitting at university at the moment in year level two, perhaps people come into psychology, people come into their allied health degrees more generally, or their medical degrees, with a mindset of I'm going to learn theory here around how to be a good practitioner. And sometimes, it won't be until I think maybe you've worked in the workforce for a few years and you've been really exposed to some of the key priorities that in the industries that you're working in, that you'll really flick the switch and start to recognize, I think, the importance of advocacy and what this really means. So I think bringing it in here for this conversation today, so early on in your degrees is really, really important because, as you say, Wendy, I mean, advocacy, it's everyone's business. And us as healthcare professionals are in a fantastic position to try and drive some of this advocacy as well. If you went out into the community and asked people, what advocacy meant to them, often people will think of, big protests or, big mass media campaigns of people coming together and trying to bring attention around certain things. But the reality is, and we mightn't even recognize this most of the time, is that as health professionals, we actually do advocacy every single day, and often quietly and often, like I said, we don't even recognize that we're probably doing it in some cases. But whenever we're pushing for changes that reduce barriers to people receiving good care, whenever we're improving the safety of for us as workers, but also the safety of the clients or the personnel that we're servicing, or strengthening, of course, access for different groups of people across the society to healthcare. I mean, these are all examples of us influencing advocacy and actually conducting advocacy on the ground. So I provided a toolkit through to you, Wendy, and hopefully you can pass that on to the cohort as well. It's just a bit of an advocacy toolkit that takes you through some pretty clear steps around if you were ever tapped by your manager in the workforce to say, hey, Wendy, I want you to go out and develop an advocacy campaign on blah, because this is a core condition that we've seen coming through the last couple of years, and we want the community to be aware of this and some strategies to be able to deal with these kind of things. At least you could refer back to a bit of a toolkit to say, right, I need to form a bit of an advocacy initiative and campaign here. What do I need to think about to do it? And what's my role in this process as a health professional as well? So I don't know, from my experience, as an occupational therapist, I did a lot of work in mental health there as well, and predominantly in the mining sector. So I used to fly out to the mining sites and do a lot of early intervention stuff around mental health for the workers on the ground, often workers, that work long hours and that are often isolated from their family for large periods of time. So mental health was a big thing out there, but a lot of stigma, of course, carried with it as well. So I had to think of some innovative ways to step through these advocacy campaigns, particularly the ones that I ran on site. And I guess my first tip would be to advocate up within your own organization and to really start there. And what do I mean from that? Well, using the things that are proximate to you, relationships, resources, people, and using those things that you have a little bit of control over to try and manipulate. Because, often when you're trying to influence decisions through advocacy, you're often influencing the decisions of people with whom you are closest to working. So an example, you might notice a pattern. A number of people are presenting with distress, and they're referred onward all of these times, but don't receive necessarily that timely follow-up. And then they might re-present again in crisis. we're looking at patterns such as this, a day-to-day simple cause of advocacy for you in terms of advocating up throughout your organisation. You might advocate for a 72-hour follow-up call for these high-risk patients, for example. It might be a weekly online check-in clinic. It could be any of these types of strategies where you've identified a pattern, a risk in mental health for the people that you're servicing, and you've come up with some cool strategies, and you're pushing this up through your organisation to try and have decisions made so that people have some guidelines to work around with how to do it a little more safely. So it's one way of going about it in the first instance. I think as well, a big one when it's all starting to develop a little more, you need to remember in advocacy, you need a coalition. Yeah, you need to work alongside different groups and peoples, often outside of your profession as well. It's a multi-sectorial kind of banding together that we really need to see in order for advocacy campaigns to really kick off. Yeah, you want obviously your health service expertise through your psychology background. You might want other health professionals that are experiencing similar issues to band together. You'll want your peak national bodies to come in with you as well. You might want politicians, community members, members of council as well. So it's easier when you're not pushing the load on your own and you have a team coming together. In a health context, you might have ED people coming together, community mental health workers, and you all meet together to try and get on top of a mental health crisis that might be sort of developing throughout the community, and to try and have multi-level strategies where all disciplines are coming together. Often when these types of coalitions are viewed by those that need to make decisions around policy change or even changes to funding model or service development, they're viewed upon a lot better if you have that coalition in place and that multi-perspective approach to try and put these together. Just gives it that evidence grounding that decision makers really do look for. And another thing to be aware of, and this might seem a little simple, but you're not in it until you're in it, and you're aware of these things. It's when formal advocacy or policy windows open up, and there will be certain pinch times throughout the year where certain doors may open, which may give you the opportunity to go forth and try and advocate for funding to try and launch a wider advocacy campaign, for example. And if you don't know that these things are available, or you're not linked in with these types of things, then you'll miss opportunities altogether. So it's an important thing to be linked in with. When things are open, like budget submissions, reform reviews, anything around service planning within your organisation. It's like with anything here, you want to be well planned, you want to have your schedule in place, you want to have your ducks in a row, you want to have your preparation ready with your advocacy statements so that when these windows open, you're best prepared to kind of be ahead of the pack, so to speak, and have your voice heard. So just a couple of tips that I drew out and from experience, really. But go back to that resource that I gave you around the advocacy toolkit. And if you're ever in a position, like I said, where you're looking into advocacy and looking at specific steps to take to get an advocacy campaign off the ground, I think it's a really clear, concise way of looking at it in the first instance, and a good place to start anyway.
Thank you so much, Nathan. And I really appreciate your point that start from your own organization, because there are some myths about advocacy, particularly campaign that we need to shout at the politicians so that we can get the money. But actually you have a very good point to start from your own organization to prepare ourselves when for example, policy advocacy opportunities comes, we prepare ourselves for it, which is very good. And also you talk about collaboration with different groups. And I would like you to give us some tips about, for example, how to do advocacy with First Nations communities.
Yeah, look, it's a big one, and I think obviously the gap between health outcomes between First Nations Australians and other Australians. I mean, it's something that for all of us as practitioners is a priority, and it's something we need to do. And I think from experience working with Aboriginal and Torres Strait Islander people, really it goes back to designing it in the way that best suits the needs of that people. And often us from outside of that culture directly aren't the best people placed in order to do this. So it's really about listening, sitting down with elders and co-designing, and sitting down with community, getting to know community, and having community come forward through support and guidance from us with the technical nous about how to put, say, an advocacy campaign together. And perhaps we can provide some guardrails in terms of the structure to do that successfully. But yeah, it's really about co-design, working closely with the communities, helping them to come up with their priority issues that might be at stake, to open their minds to the opportunities that might be available outside of the community in order to receive support, funding, potential policy change with the direction, and to always do this in I guess a dual way with these individuals and communities as well. Otherwise, often we've seen it a lot in the past, where people may come in with these ideas or concepts that might seem fine to us as practitioners living in Townsville. The reality is, it's not what's happening on the ground in Indigenous communities in far North Queensland. And if we miss that context and miss that understanding and go forward with this work, it's obviously when we see advocacy done not in the right way, missing the mark, and things don't get off the ground, or they're not sustainable without that community input at that level. So that's probably from experience the one tip, and this is a full sensitive sort of process as well, and I really haven't given it justice because it is a deep process, and it's a deep process of consultation and negotiation and co-design to get it up. But without those ties to community and that community lead in these situations, yeah, we've got Buckley's chance of having an effective advocacy campaign coming out the other end.
Thank you so much, Nathan. Yes, co-design and also ownership, Indigenous ownership of the advocacy campaign is always important part when we work with, not for, First Nations community. And Nathan, from what I read in your publications, and there is one point I picked up, is that mental health care is strongly influenced by the broader policy environment and structural systems. Nathan, could you please briefly describe the current mental health policy landscape in Australia at a structural level, and what role can us as health professionals play in shaping this landscape?
Yeah, no, it's a good question. It's and something, I think the overall landscape of the policy context in Australia, it's complex, it's ever evolving and ever changing. But look, briefly, it's shaped by and shared responsibilities of both the state, but predominantly the federal government here in Australia. And it has a bit of a mixed system as well of input of stakeholders through the public, private, and also community healthcare sectors. Look, I think in terms of policies, a massive national lever, which a number of you might be familiar with in the psychology degree, is the National Mental Health and Suicide Prevention Agreement. And I'm just trying to come up with a recent example here, but it really sets out or tries to set out some shared objectives and is implemented through the states in order to try and come up with strategies around obviously suicide prevention predominantly. But when it did drop, we know that there has been a lot of scrutiny around this and how effective this agreement has been and its approach. And there is a formal review that's sort of tabled at the moment. So if I could think of a recent sort of policy to read up on or agreement to read up on that's really influencing the national policy landscape at the moment in Australia, I think that would be one to keep close to heart, as it's certainly evolving under intense scrutiny, and we'll be interested to see what comes out of that. The reason I say that is that it's when policies come into light at the structural or national level, often health practitioners will play a really key role in terms of providing ground level knowledge in terms of what's going on within their respective jurisdiction. And in review of policies as well, or agreements such as this that have been scrutinised as perhaps not working as efficiently as or effectively as others might think, again, us as health practitioners will often be sought out to provide advice as to why things mightn't be lining up on the ground. Keeping in mind that structurally, things need to be informed well. They need to trickle down a number of different levels before it really impacts on us and how we practice as psychologists. And it also impacts on, obviously, the people that we serve as well. So when I'm thinking about the roles that practitioners play within shaping this landscape, I usually think of probably two main levers for health professionals. As I said, really us in the planning operation of it being the ground truth, the ground truth, the evidence of what's happening on the ground through our own experiences and perceptions, and how this is captured into policy and planning is key, because obviously we want policy to reflect what's happening on the ground. And we see all the time people falling through gaps, particularly in the healthcare system. We see groups missing out on care and access to services. And this kind of comes down as well to these high-level policies being made without consultation being had with key groups like health practitioners, for example, and therefore the full picture not being gathered before it going into documentation and legislation, which obviously impacts on these groups as well. On the other side of it, though, health practitioners, so that's the planning. On the other side, I think we play a really, really critical role in the implementation of policy as well. Obviously, even when policy, it's set at a national level. Yeah, we know this. But what matters at the end of the day is how we implement this locally and on the ground. Yeah, how did this policy trickle through our workforce models? How is it evaluated on the ground by our workforce as well? And what are different access points where us as health practitioners can come in contact with these policies and provide information upwards around certain changes that might need to be made in terms of what we experience as well. Now, I've just added a couple of recent papers, Wendy, to the reading list here for this as well. I've done work around suicide postvention predominantly. I would probably brand it as with the military. There's a paper there on the scoping review that we conducted a couple of years ago. But also another current area of interest for me is around postvention in agricultural communities and what suicide and the ripple effect of that might have in these kind of contexts. So the reason I kind of draw these out are just kind of case examples, I guess, to step us through about how us as practitioners could be involved in sort of this interprofessional research endeavours to try and influence policy through the findings that we have through not just through peer reviewed publications, but through expressing through different conferences and different forums the experiences that we're really, really having here on the ground. So the one on the social determinants of suicide and suicidality in serving military personnel really highlighted that the risk is linked to determinants of health. We often brand them in public health as the social determinants of health, and these include social support, addiction, socioeconomic status, education, and occupational factors. So the key findings from that review were that these social determinants were particularly linked to cases of suicide and suicidality within serving military members. So from a policy perspective, it tells us that if we only respond with clinical services, we may actually miss what we call the structural drivers, or those factors sitting at a broader level, and that could impact on access to care and being able to receive these services that people require. And in this context in defence, we might then need to promote advocacy, and this advocacy in this context again could include strengthening, support pathways within certain areas of the military. It might be through advocating for education and resources around leadership practices that help to reduce stigma and improve safe help seeking for people that are experiencing cases of suicidality. Again, something within the defence environment that is quite different in terms of its makeup to the general community. Addiction was a big one that came through in these findings as well. So again, targeted alcohol and addiction risk strategies. I mean, these are things I'm throwing out, not as a psychologist. And again, you guys are probably better grounded with these clinical interventions than I. But just examples around how our experiences and our findings through research, but also through our professional experiences, and making sure that we're always willing as psychologists to take that step out of our comfort clinical zone, step into forums and different conferences as well. If you get any of these opportunities as students, for example, and you do have passion areas, I mean, they're great forums to try and share some of these insights. And really, you mightn't recognize it at the time, but some of these conversations are what can spawn into bigger advocacy projects that can really help to reform or influence the broader state or even national sort of policy sort of realms. So a bit of an example there through that paper anyway. And you'll see in a number of research papers, particularly in the mental health fields, I think, the implications of papers and findings are all sort of targeted to some degree at trying to advocate for change to the organisation of a health service, for example. Could be changes to funding structures. It could be changes to policy. And again, it's an active part, even if you choose the clinical pathway, where I do a lot of research, and Wendy, I know you do as well, with active clinicians as well. And often these are the best findings that we can put together, merging those academic and also clinical insights to try and gain traction, to try and make positive change through the structural drivers, funding models, policies, so that we can see population level change that then trickles back into the individual change as well. A bit of an example, a bit to get your head around, but it's really, again, working at the upstream level, working at that population level, trying to make that change, broadly speaking, and hope that we've got the systems and structures in place so that that can waterfall down to making good change on the ground for us as workers, but also for the people that we service as well.
Thank you so much, Nathan. Yes, indeed. For example, we work at the population level and then translate back to the individual level so that more individuals can be benefit from the population level. And also, yes, social determinants. I really appreciate the point you mentioned, social determinants. Social determinants is one of the principle of population mental health indeed, and it's important for us as health practitioners and psychologists and public health promoters that work at the population level and help people to help the groups and also communities to maintain mental health. And thank you so much, Nathan, for today coming in and give us lots of useful tips about translating theories, models of mental health advocacy and policies into practice from the perspectives of planning, interpretation, collaboration, and evaluations as well. I'm sure students will learn a lot from your talk. Thank you so much.
No worries at all, Wendy. It's lovely to have the opportunity to present. And if anyone has any questions about any of this stuff or keen to link up for further conversation, I'm sure Wendy will share my details through the subject side as well. So thank you.
Thank you so much.